Hello, everyone, and welcome to the SKC WebIH webinar learning series. My name is Lucineta Alvarado, and I am the corporate CIH and the technical services manager at SKC Inc. What we'll discuss today is a topic that you see nowadays, even in your sleep. Is a topic that is causing a lot of stress, not only in the workplace, but also in our personal lives. It is the COVID-19, SARS-CoV-2, or coronavirus. This microorganisms is causing a lot of issues, and many people worldwide is being affected by it directly and or indirectly. With me is the president of SKC Inc., Mr. Doug Dewis. He will be the panelist that will assist with the questions at the end of this webinar. Before we start, I have to give a shout out to our marketing and IT department and everyone who was involved in this, in setting this webinar. Thank you so much for all your help. Before we start, there's some housekeeping items. The recording will be available after the webinar. If you have any questions, you may submit them in the WebEx box, which is located in that main screen for the webinar. And at the end of the webinar, we will have like 5 to 10 minutes to answer these questions. If by any chance we're not able to answer all of the questions, we will create a question and answer sheet with all the questions and all the answers, and it will be distributed to you with the recording and the copy of the slides. This is the agenda for today. We will discuss what is the coronavirus, the symptoms, the confirmed cases at the times, and then potential workplace exposures. We will share with you what SKC has been doing to address this emergency, and also the resources used in the development of our response plan. Last but not least, we will share sampling solutions we have identified to address the virus and analytical methods available at this point in time. As a caveat, the information presented is based on the information available at this time. This is a new virus. The guidelines, analysis, and information in general changes by the minute. SKC is constantly following up to provide the most accurate information for you. We are not epidemiologists or virologists. However, we are providing this information to you as guidelines and potential solutions on how we deal with this new virus. All right, what is coronavirus? This information you may already know, but it is a large family of viruses that causes illness ranging from the common cold to more severe diseases like the MERS-CoV in 2012 and the SARS-CoV in 2003. This current virus is a respiratory illness that can spread from person to person. We have seen so many names from this new virus. According to the World Health Organization, the disease is called COVID-19, and the virus is called Severe Acute Respiratory Syndrome, Coronavirus 2, or SARS-CoV-2. Why does it have different names? The WHO chose the name for the virus because it is genetically related to the coronavirus responsible for the SARS outbreak in 2003. While related, the viruses are different. WHO announced COVID-19 as the name of this new disease on February 11, 2020, following their own guidelines. Now we can understand the language in the news when they talk about the disease and the virus. COVID-19 is the talk of the day on the news and social media. The total number of cases and recommendations on how to protect yourself changes by the minute. The world is affected by this, and many people question what will be the outcome of this situation from a health, social, and economic standpoint. On March 11, 2020, the WHO publicly characterized COVID-19 as a pandemic. Today is April 13th. We have been dealing with this situation for a little more than a month now. Wow, time flies, don't you think? As you may know, the main symptoms ranges from a mild to severe respiratory illness with fever, cough, and shortness of breath. Some people infected with the virus have reported non-respiratory symptoms. Other people referred to as asymptomatic cases have experienced no symptoms at all. As I mentioned earlier, since this is a new virus, the information changes by the minute. So it is very important to stay tuned to the national and local news, as well as entities such as CDC, the WHO, etc. This is a very good map from Johns Hopkins University showing the total cases confirmed, the total deaths, and total recovered. The numbers are updated frequently, especially now that more tests are available. It is all over the world now. Fortunately, there continue to be a significant number of recoveries. We hope that this gets better soon. All right, from an occupational standpoint, these are the industries that have a high potential risk of exposure. All of these have one thing in common with the virus. They interact with people. Because the virus can spread person to person, employees with these industries are at high risk. We have to give a big shout out to those individuals that work on these industries. If you're listening to us right now, thank you for all that you have been doing to treat and protect us. Please stay safe out there. All right, we're gonna switch gears a little bit. We're going to share with you what SKC has done at our sites to minimize the exposure to the virus and to keep running our businesses. I hope this information is helpful. We are very, very proud with what we have accomplished so far. We are following the emergency management principle that includes the preparedness, response, recovery, and mitigation. Since the event has evolved so quickly, the plan was developed while doing and continues to be improved. We were working on the plan even before the COVID-19 was considered a pandemic. We were right there on the roll. We're not doing this alone, and we're using many resources such as the CDC and WHO websites, OSHA guidance on preparing workplaces for COVID-19, and also the book, The Role of the Industrial Hygienist in a Pandemic from the American Industrial Hygiene Association. These are great resources with clear and organized information and very useful during these difficult times. This was the procedure, excuse me, that we followed to prepare the emergency plan. I will describe them briefly, like each of the components in the upcoming slides. All right, as an industrial hygienist, the process starts with a hazard recognition or a risk assessment. Among the questions that we asked were like how it spread, what are the symptoms, what is the type of industry that we're in, and what tasks are performing our site. OSHA, in the guidance that I've referenced earlier in the previous slides, classify the risk based on some criteria. After evaluating the questions and the criteria, our risk level is low at our production facility. And there is a limited public access, so we follow the recommendations for the low risk category. We are following a more conservative approach in some areas as we want to ensure our employees are safe. Fortunately, we are classified as an essential service and allowed to stay open to help our customers during this time. So we're very lucky. From an administrative and work practices standpoint, we put together policies based on what you have seen in the slide. We created 2 teams for our production and operations staff, identified as purple and green, which are our company colors. These two teams alternate production days and times. We have as many employees as possible working from home at this point. Travel is suspended at this time, and we have very strict housekeeping policies. Based on the plan, we have trained our employees in the practices and guidelines established by our sites. We also established policies for visitors and deliveries. They are aware of what we do or what to do when coming in our facilities. We also have criteria when we identify case contacts. If there is an employee that got in contact with a suspected case, we discuss the situation and advise the employee to stay home for approximately 1 to 2 weeks and monitor the symptoms. After that time frame, if the employee doesn't show the symptoms, then he or she can come back to work following the implemented practices. As I said before, we have strict procedures on housekeeping and hand washing following the guidelines provided by the CDC. Each department has protocols in the disinfection of equipment and common areas. We also follow the cough and sneeze etiquette. For an employee relations standpoint, that includes how we run the business. We establish effective communication to avoid that stigma and resiliency. And so far, we are open for business and things are running good under the circumstances. So we're pretty happy about that. Thank you to our marketing and communications department, because we have created posters, emails, web-based communications to our employees and also to our customers regarding our status, recommendations to follow during this emergency, and also other important information. Like other companies, we send letters and messages from the president related to our status. We have an emergency responders on call in case there's an incident or an emergency that may happen on site. We also developed an automated phone and text message system where we contact our employees with updates and or changes in the established protocols. As far as engineering controls, we did a walkthrough to verify that our systems are working appropriately. Because we are at low risk, there was no need to add controls. In our case, we don't have a triage location and we are not screening the employees in terms of like taking their body temperatures. Fortunately, and knocking on wood, we haven't got any confirmed case. However, we are prepared to take the temperatures and to screen people in case we have a confirmed case on site. What we do have is quarantine locations for those packages and mail that comes in the site. We're keeping those packages in that area for like approximately 24 hours before they go in the buildings. As far as personal protective equipment, we evaluate the need for additional PPE. Keep in mind that when selecting PPE during this virus, you also have to keep the PPE already required in a workplace. At SKC, in addition to the usual PPE used during normal times, we have implemented disposable gloves used as needed, especially for the cleaning crew and also the homemade fabric face mask recommended for use by employees when away from their workstations. The photos that you see in the slide represents the hard work that our people is doing. Our president's wife, which is an excellent seamstress, made face masks for our employees to wear voluntarily at our site. Thank you so much for the time. Those were pretty cool face masks, actually. Respiratory protection is the biggest question. OSHA have enforcement guidelines during the COVID-19. The link that you see in that slide will give you access to those guidelines. SKC has been fortunate so far, but our plan includes the use of N95 respirators for any contact with no COVID-19 cases, and surgical masks are available if we have any employees that calm down with the disease, recover and return to work, or also in other situations. Other companies should also consider the use of eye protection and face shields when needed. Of course, everyone should get proper training on use of PPE. Keep in mind that OSHA and CDC guidelines are updated regularly, so please stay informed. Just an example here, OSHA has relaxed their policies on what type of PPE is allowed and requirements for annual fit testing for respirators. The CDC now recommends the use of face masks by everyone when in public. So please stay informed. Check those websites, look at the news, etc. After we took into consideration all the parameters discussed, we established an incident command team. It is typically used for other types of emergency like spills and fires, but we consider that this approach was the best way to establish the plan and stay focused. We have teams for the command, operations, logistics, planning, and admin and finance groups. Each of these teams was responsible for the tasks that are described on the slide, and we have periodic meetings to share information and make any change to the plan. We are extremely proud of how we have handled the COVID-19 emergency. There's a lot of stress and long days, but we are together working as a team beautifully. At home or our production site, we follow the recommended practices and everybody is safe. We're working very hard to keep our business running and take care of our customer. It is about science serving people. We are stronger every day. We are SKC strong. All right, now we're gonna talk about area sampling solutions. We're gonna switch gears again here. SARS-CoV-2 that causes COVID-19 is a new virus with many unanswered questions. However, scientific professionals look to previous investigations of coronaviruses, such as the SARS-CoV, not the two, just the initial one, and the general principles of evaluating biological contaminants may also apply. What you will see in the upcoming slides are the background of what is a virus, the modes of transmissions, equipment, and media that we have identified that can help evaluate viruses. Our purpose today is to provide a brief summary of the work that has been done to progress the science in this area. This is a fast-changing situation, and we are all overwhelmed with the new information. We are dealing with new vocabulary in general and at work, from social distancing to how to detect the virus from an analytical standpoint. We should build on what has been done to answer the questions that have and will come up. This is new to all of us. With a new mindset and using our expertise, we can defeat this virus. All right, so a little bit of a microbiology 101 here. We need to, first to accomplish the goal, we need to understand what is this type of microorganism. Viruses, some people refer to them as the invisible foe. They cannot live by themselves, and viruses always need a host to survive. These microscopic organisms are they're everywhere, and they can cause so much trouble in our daily lives. from the common flu to a worldwide issue like we're feeling today, actually. It affects all living organisms and can only produce within host cells. The core contains DNA or RNA, single or double-stranded, and can only be seen with an electron microscope. They need a host to survive. Compared to other microorganisms out there, these are the most complex to evaluate and the most difficult to eliminate. You might ask why we should perform an air sampling for this virus. There's no standard method for virus sampling. It is not typically evaluated during exposure assessments of indoor air quality investigations. Therefore, why we should do this? Well, since this is a new virus, we can do more research to answer many questions like, what is the virus type of transmission? The testing can also be used for clearance after cleaning procedures in a hospital, for example, to determine whether or not the virus is still present in that area. There are a lot of uncertainties at this time, but this may be a good start. After the SARS outbreak back in 2003, there has been some research from the National Institute of Occupational Safety and Health, or NIOSH, and the CDC. In addition, a lot of research has been done in Asia, since this is a high population density location. We will highlight some of these research studies in the upcoming slides. Okay, before we go in on the research work, it is important to highlight that sampling for viruses is not an easy task due to the different factors. And this includes relative humidity, temperature, radiation, aerosolization medium, exposure period, chemical composition of the air, and sampling methods. Previous SARS-CoV investigations focused on identifying environmental contamination in infected areas and the potential for transmission to adjacent areas. Sampling approaches included swab sampling of surfaces and air sampling followed by the DNA-based polymerase chain reaction, which I'm going to call PCR, analysis. Consider that viruses are not routinely sampled in indoor air quality investigations because they're typically found in very low levels that are difficult to detect. SKC recommends that you seek guidance from a qualified environmental microbiology laboratory with the expertise in viruses before performing any air sampling or studies. Okay, this is the million-dollar question at this time. Is the virus transmitted by aerosol or is it airborne? Scientists have different opinions of this topic. There's some scientific papers that suggest that the new coronavirus can exist as an aerosol under very limited conditions. Others suggest if it could easily exist as an aerosol, we will see much of a higher levels of transmission. Then according to the rate of transmission, it seems like the coronavirus 2, which is the current virus, is predominantly spread through the droplets and not as an aerosol. Unfortunately, there's not a final conclusion as to whether or not the coronavirus 2 is an aerosol. What we can do as scientists is to continue the research and collect data at this point. Also, we need to continue the recommendations to flatten that curve. Okay, now we're gonna talk about the differences between aerosol transmission and airborne transmission. From the aerosol transmission, some diseases can be transferred by infected droplets contacting surfaces of the eye, nose, and mouth. This is referred as to droplet contact transmission. The droplets containing microorganisms can be generated when an infected person coughs, sneezes, or talks. It can also be generated during certain medical procedures, such as like a bronchoscopy. These are too large to be airborne for long periods of time and quickly settle out of air. The aerosol transmission can be reduced with the use of personal protective barriers, such as like face masks and goggles. Measles and SARS are some examples of the diseases capable of droplet contact transmission. Now we're going to talk about airborne. Airborne transmission refers to situations where droplet nuclei, residue from evaporated droplets, or dust particles containing microorganisms can remain suspended in air for long periods of time. These organisms must be capable of surviving for long periods of time outside the body and must be resistant to drying. Airborne transmission allows organisms to enter the upper and lower respiratory tracts. Fortunately, only a limited number of diseases are capable of airborne transmission, and these includes the tuberculosis, chickenpox, and measles. I don't know if you noticed, but measles is in both aerosol and airborne. That is why it's very contagious. Okay, now we're going to talk a little about research papers here. The WHO had a recent scientific paper titled "Modes of Transmission of Viruses Causing COVID-19: Implications for Infection Prevention and Control Precaution Recommendations," or IPC. In this paper, there are some good points to mention regarding aerosol and airborne transmission. For example, droplet transmission occurs when a person is in close contact, like within like 1 meter, with someone who has respiratory symptoms like coughing and sneezing, and is therefore at risk of having his or her mucus, like in the mouth or nose or in the eyes, exposed to potentially infected respiratory droplets. Transmission of the COVID-19 virus can occur by direct contact with infected people and indirect contact with surfaces in the immediate environment, or with objects used on the infected person, like using a stethoscope or a thermometer. The airborne transmission may be possible in specific circumstances and settings in which procedures or support treatments that generate aerosol are performed. So some of the examples may be like opening suctioning or administration of nebulized treatments, those medical procedures. The WHO, from this paper, has very interesting conclusions based on the studies they reference in the paper. The first one is that they continue to recommend droplet and contact precautions for those people caring for the COVID-19 patients, and recommend airborne precautions for circumstances and settings in which aerosol generating procedures and support treatments are performed. These are according to their risk assessment. They also recommend airborne precautions for any situation involving the care of COVID-19 patients, and consider the use of medical masks as an acceptable option in case of shortages of respirators, such as the N95 respirators. Based on this information, it seems like the mode of transmission and recommended PPE depends actually on the situation. Okay, now that we have a better understanding on what is this virus and the potential mode of transmission, let's talk about the equipment, which I call IH toys, that can be used to assess the virus. What you see here is a snapshot of the bulletin that we create summarizing what is the new coronavirus and their air sampling options. And actually, you can download this bulletin. There's a section on the main screen of the webinar here that says handouts. That's where you can download the bulletin. It is also available on our website. And the link is in the slide as well, so you can download in the different areas. The order that the samplers will be presented is different from how they're presented here, but I mean, we're gonna discuss each of them. The first one, it's what we call the biosampler. It's a collection method. It looks like an impinger, but it's not an impinger. The particle collection is achieved by drawing the aerosol through the 3 nozzles directed at an angle toward the inner sampler wall. Instead of making bubbles, the liquid swirls here. So it has 3 nozzles instead of 1. The collection liquid swirls upward on the inner surface and removes the collected particles. You may use a non-evaporating collection liquid that have a higher viscosity than water, such as the vial trap mineral oil. However, and this is important to consider, you may need to check with the lab since it may not be suitable for PCR analysis, that use of the vial trap. You may need sterile water for viral collection. And this is how the biosampler looks like. The biosampler needs a pump capable of sonic flow. What that means is under sonic flow conditions is that the sonic velocity is reached at about 0.5 atm, which is like 15 inches of mercury, pressure drop across the orifice. Further increasing the pressure drop won't change the flow. In case of the biosampler, its nozzles limit flow through it at a nominal like 12.5 liters per minute. The nozzles of the biosampler defines that flow. That's why it's causing that swirl movement. As long as the pump can create and maintain that 0.5 atm pressure drop across given orifice, the air will move through this orifice and it's at the speed of sound. That's what it's called sonic velocity. And the pump that we have that have those sonic velocity capabilities is called the BioLite, which is in this slide. Okay. All right, this is a chart from a paper from the Environmental Science and Processes and Impacts, which titles the evaluation criteria for bioaerosol samplers. This is a paper that they did, and they evaluated like different types of samplers for bioaerosol sampling. This chart shows the 29 samplers that they tested and their respective sampling efficiency. Based on the data, the biosampler is one of the samplers with a high collection efficiency. Many researchers have used the biosampler as comparison with other samplers. Their data suggests that the biosampler is the gold standard related to bioaerosol sampling, and that you will see the link in that slide if you would like to look at the whole paper. Okay, we're going to discuss the pros and cons for the use of the biosampler. The pros include the glass construction makes it easier for cleaning and sterilizing and reuse. It's a high flow rate. Also, the 3 tangential nozzles eject particles at an angle to the inner wall, reducing that particle to bounce, and it preserves the microorganism integrity. The swirling liquid collection method minimizes the reaerosolization and gently entrains bioaerosols to preserve viability. And when we use the biotrap, the collection efficiency stays constant over an 8-hour sampling period. So you don't need to worry about potentially the liquid being evaporated if you use the biotrap. The cons, you need a specific sampling pump with sonic technology, such as the BioLite that I mentioned. And it's not ideal for personal sampling due to the size of the sonic pump. I mean, this pump is big. It's typically used like for areas, area sampling. Okay, we're gonna talk about another type of sampler. This is the 0.3 micron 37 millimeter PTF filter preloaded cassette. These were the same filters that were available for the SARS outbreak back in 2002, 2003, that occurred in Canada. The pore size on these filters are based on particles in water and not on air. That is why they are very good to use for virus sampling. It is estimated at 99.9% collection efficiency for viruses. According to the American Society of Microbiology on a 2008 paper titled Methods for Sampling Airborne Viruses, it states that this type of filter, the PTF filter, appear to be the best option for long-term sampling of 10 to 900 nanometer diameter virus-laden particles. As far as the air sampling, the flow rate and the sampling time are depending on the total volume that you want to achieve in the sample. Keep in mind about the pump and filter. This filter may create back pressure if you don't have a good pump, and you may have problems during the sampling. This is a paper from the National University of Singapore, then the NIOSH, and Duke University Medical School. And the paper is titled Aerosol Sampling in Clinical Settings, a promising non-invasive approach for detecting respiratory viruses. In their conclusions, which are highlighted here, they stated that this type of sampler has potential as a non-invasive method for novel respiratory virus detection in clinical settings. And that's the link that you can access the whole paper. Of course, this sampler has its pros and its cons. The pros includes, this is an easy sampler to use for sampling. It's a small sampling pump with a small cassette. It's pretty much like doing a typical earth sampling. There are stable up to elevated temperatures, like up to like 500 degrees Fahrenheit or 260 degrees Celsius. They are hydrophobic. That is why they're good for this type of sampling. The cons include what I just mentioned regarding the back pressure. Make sure you have a good pump and set the flow rate so that you will not have a fault in the pump. Because of this potential back pressure, it can cause a limited sample volume. A good thing also is like if you like to get the filters and assemble the cassette, you need to make sure that you don't leave leaks or the cassette is too tight, because it can cause either a leakage or too much back pressure. Fortunately, there are preloaded cassettes and you don't need to worry about the assembly. These are like ready to go for sampling. Okay, the button sampler is another alternative that is characterized by inhalable size bioaerosols. It provides collection of inhalable particles, including bacterial and fungal spores, for viable and non-viable analysis. With the use of this gelatin filter, it provides a maximum survivability and superior collection of inhalable sized bioaerosols with a 93% collection efficiency. The sampling rate is 4 liters per minute, and the sampling period is short, so it's a maximum of 30 minutes. This is a paper from the Annals of Occupational Hygiene in 2007 that tested the physical collection efficiency of commercially available filters for collecting airborne bacteria, viruses, and other particles in the 10 to the 900 nanometer size range. One of the collection samplers used was the button sampler with the gelatin filter. And according to their results, This sampler showed a collection efficiency of greater than 93% for all of the test particles. So those are highlighted in the slide here, and the link is there as well. Okay, the pros and cons for this sampler. The pros includes that improves collection characteristics of inhalable particles, less than 100 micrometers aerodynamic diameter, and equal distribution of particles. The main issue that you may encounter by using this sampling media is that gelatin filters can easily dry out. So that's the main con here. They cannot be used for longer sampling periods just because of it. That's why we recommend like a maximum sampling time of 30 minutes. Okay, although not available from SKC, this is worth to mention. This is a sampler that was developed by NIOSH. The NIOSH sampler is unique in that it size fractions by aerosols and collects them in disposable centrifuge tubes, facilitating direct processing of samples. As air is drawn into an inlet at 3.5 liters per minute, the first stage, which is this part here, particles that are greater than 4 micrometers are collected into a 15 milliliter centrifuge tube. In the second stage, which is the one shown right here, 1 to 4 micrometers are collected into a 1.5 milliliters microcentrifuge tube. And particles that are less than 1 micrometer are collected into a 37 millimeters PTFE filter, which is this part right here of the sampler. NIOSH used the SKC biosampler, excuse me, as a comparison. In the published paper, they said that their sampler surpasses the reported viable recovery rates of most commercial samplers except the SKC biosampler. The NIOSH sampler seems to be lightweight and easier to handle, but it's not commercially available at this time. This sampler has been used mainly for research. For example, in 2008, Duke and US Medical School used this sampler to evaluate airborne viruses on board MRT trains in Singapore, including influenza and also other viruses, which cause flu and flu-like symptoms. So these are photographs of how the sampler looks like and how it was worn during that study. Okay, now that we talked about the samplers available, let's talk a little bit about the analytical methods. The American Conference of Governmental Industrial Hygienists, or ACGIH, they report that air sampling for viruses is not routinely done. There are no specific methods from NIOSH or OSHA or other entities that we are aware that we are aware of or can be used. In addition, there are no exposure limits available at this time for viruses, especially for COVID-19 or the respective virus, the coronavirus 2. However, for viruses, since it only has that DNA or RNA strand or double strand, can be detected using real-time reverse transcriptase polymerase chain reaction, which I'm going to call RT-PCR. That was a long name. Or quantitative PCR, a culture, and DNA analysis. According to studies, the capture efficiency or total physical efficiency is based on the rate of recovery or different particle sizes, and is measured with methods independent of the integrity of the viruses, while the efficiency of viral recovery is, in most studies, an indicator of the remaining integrity and infectivity of the sample viruses. There are research papers out there that have identified equipment that can be used for analysis, and that's just a list of it in the slides. Most of them, they're PCR based. So basically, if you have PCR capabilities and similar equipment, you may be able to detect the SARS-CoV-2. The illustration that you see in this slide is a genomic organization of different viruses, including this new coronavirus. Actually, this picture was taken from a paper from the U.S. National Library of Medicine, National Institute of Health, titled Coronavirus, an overview of their replication and pathogenesis. So that's the link for your references. As I said before, I'm not a virologist by any means, but this is to show you how experts look at those viruses. These are some of the snapshots of some of the papers, in addition to the ones mentioned previously, that are available related to the collection of bioaerosols, in this case, for viruses. These are done during the SARS and the other epidemics that have been happening over the past 10 years or so. Many of these studies stated that the media that SKC offers have shown to be adequate for the aerosolized virus sampling. Of course, there are limitations for the sampling media, equipment, the virus characteristics, and environmental conditions. It is a matter of selecting the appropriate sampler or method depending on the scope and what would you like to achieve. Also, more research is needed. This is a great opportunity for all of us as health and safety scientists to gather more data and help flatten the curve so our lives can get back to what was before. All right, so SKC hopes that the information of this webinar, sorry about that, was beneficial for you. Doug and I will now take care of the questions. We're gonna try our best to answer them we have like 10 minutes now or so. If we cannot take all the questions at this time, as I said before, we're gonna create a sheet with all the questions with the answers. So Doug, are you there?
Thanks for your time today. Thanks again for your time, Lucinette, very good job. There are quite a few questions here, and we have 10 minutes, so I'll cover what I can. The first one that came in, well, before we get to the questions, I want to clarify one little point. There was a slide, a mention of the difference between aerosol and airborne transmission. With the virus can be spread through aerosol transmission. One of the questions that needs to be answered or is under investigation is what about airborne transmission? In other words, if the RNA strand of the virus is in an aerosol, a sneeze aerosol, for example, and then that evaporates, there's still that particulate that could stick on a dust particle or something. And the question is, again, can that cause any type of infection, transmission? So I wanted to clarify that before I got into the questions. The first one is, how can you get the analysis done when the labs are already overwhelmed with personal sampling? And that's a really good question. Mm-hmm. The priority is, of course, the patient studies, the biological sampling, and air sampling would probably take a back seat to that. What I'd recommend is if you are a lab, or if you could recommend a lab or know of any labs, please let us know. We can put that information on our website and send that out with the question and answer things. SKC, we do not have a laboratory. We are only in the air sampling equipment business. So we don't have an analytical lab ourselves to test outside labs. Of course, inside, we do have QC labs and that type of thing. The second question is air sampling for COVID-19. What is the application? Is it for hospitals or for clearance in the area that was inhabited by COVID personnel previously? Lucinette, do you want to answer that?
Those are good applications to do the sampling at this point. Yes, as I mentioned in the previous slides, if there's like, if you have a place when you have like cases, like confirmed cases of coronaviruses, and you did this massive cleanup, if you want to make sure that that virus is out of that place, you can do the sampling. Yeah, I don't know if you would like to add more to that, Doug.
Yeah, I mean, a lot of this is, there's no method for this. For a lot of chemicals, for example, hydrogen sulfide, to use a certain method and there's a certain exposure limit. There are no standard methods for sampling for this virus or for viruses in general. There's also, and one of the questions was, I'll just jump ahead and answer that. There's also no exposure limit. So it should be treated as, a lot of the nanoparticles that, because of the risk, no exposure is acceptable. So again, we're doing this webinar to tell you, to explain some of the work that's been done in the past with our equipment to promote the science. There are applications for example, clearance testing. Our biosampler, for example, was used in different areas, and it has shown in Singapore and in China that to show that you can collect viruses in general in hospital areas. So again, we're just talking about the science here, and there's no specific method. So one of the next question is, early on, we listed solid and wastewater workers as at higher risk, but OSHA has earlier said that they're at no greater risk and no extra PPE was needed. Has that guidance changed? And my comment on that is that and Lucinette, feel free to add to that, is that things are changing daily. And so keep up with the latest OSHA recommendations and OSHA guidance.
Yes, just to add a little bit, in the website, in OSHA's website, they just always keep changing, not changing, but providing guidelines on those specific type of standards or regulations that may affect or may be affected by this situation. So just look at it, and they have like a hotline that you can call if you have questions.
Very good. One other question here is, what do we tell employees about decontamination of the homemade face masks?
Yeah, that's a very good question. There's a lot of different options out there, and actually, we internally here we're trying to test them. We can put more details in that Q&A sheet that we'll provide, but it depends on the situation. And yeah, there's what I can say is, whatever you guys decide to do, just make sure to address the employees on first, if they're gonna do it, how they're gonna do it, and also the chemicals or whatever substances that they will use to disinfect. Because what we don't want to cause is whenever they're doing it, if they put it back on, they'll be exposed to whatever they use to clean the face mask. So as I said, we can put a more detailed answer to that question, but overall, that's my main, that's my highlight for this question. So Doug, if you want to add.
Yeah, just in general, just there should be, minimal exposure. We do recommend that the employees wash their masks daily in soap and water and dry them in a hot dryer, and iron them. They can microwave them if there's no piece of wire in the mask. We have about 2 minutes left.
Okay.
And there's been a lot of questions here about labs and whether or not there are any labs that we could recommend. We'll be happy to put the names of labs on our list, on our website. If you know of any or could suggest any, we'll follow up. We did reference in there the AIHA's laboratory accreditation program, the environmental microbiology labs. They would need to be certified in PCR analysis in order to do this type of analysis.
Yes.
And last question here, I guess, is our equipment would give you a quantitative number. It's not qualitative. It's not like a colorimetric tube or something. It would give you a number, but the environment changes, and you're looking at very low levels. So it's a comparison normally of clean or not clean. Lucinette, any final words?
No, I just want to say thank you everybody for your time. I hope that this information helps you during this difficult times. Please, everybody, follow the recommendations from the CDC, the WHO, your employer. If you have any questions or comments, that's our email. You may send us a message there. As I said, we'll get back to you with a copy of the presentation, the recording. You have the handouts for that bulletin of the samplers. So just stay strong as we do here in SKC. We're keeping strong, and we're gonna go through this.
And thank you very much. Please
All right,
email
thank
us
you,
if you have any
everyone.
questions. Okay, bye.
Bye.